Good morning, and welcome to the Virginia Interfaith Live broadcast. This is a weekly broadcast produced by Virginia Interfaith Center for Public Policy. I'm Roberta Oster, the Communications Director. Our program brings you the latest news and resources from policy and faith experts, as well as community leaders and activists. You'll be able to ask them questions live during our broadcast on Facebook and Twitter. During these difficult times dealing with COVID-19, our broadcast will focus on economic, racial, social, and environmental justice issues here in Virginia. We will keep you up to date, and we will keep our elected officials accountable. We'll also share resources and opportunities for you to get involved in our work advancing social justice and helping our neighbors. Today, we are addressing a critical issue: race, health equity, and COVID-19. I'm pleased to welcome our guests and introduce my colleague, Dora Muhammad, who is our Congregation Engagement Director here at the Virginia Interfaith Center. Thank you, Dora.
Good morning and welcome. Thank you for everyone joining us online and via Twitter. I'm very excited about this show. At Virginia Interfaith, I oversee our health equity work, as well as I'm part of the racial justice team. And so COVID-19 has really collided both of these issues and brought a magnifying glass on them for our country. So joining us today, I'm very excited to welcome one of our board members, in fact, Reverend Eli Burke. He's Director of Health, Men, and Social Justice at the Baptist General Convention for Virginia. He's been a staunch healthcare advocate, so looking forward to engaging and inspiring faith communities and people of faith. And then also with us is our cabinet member level. We have Dr. Janice Underwood. She is the Chief Diversity, Equity, and Inclusion Officer in the government for Virginia. She's the first ever to hold this position, and in the nation, she's actually the first cabinet level Chief Diversity Officer. So very, very excited about just the groundwork that she's laying out, and the foundation for the work is really going to be leading the country in diversity and equity work. So if I want to just sort of ask both of you if we want to share a few opening words before we kind of delve right in. Eli, if you would like to go first, and then Janice, you can follow.
As you are aware, as you have noted, that we've been working in the area of improving the health of African Americans for many years. And we're at a juncture now where we see the importance of health equity all the time, as we see a conflux of things happening in the community health-wise that are a result of some historical things that have been happening all along. So I'm anxious and excited about being in this discussion.
Thank you. And Janice?
Honor and a pleasure to be with you and the whole team here, and good to see you all and good to meet you. Hello to everyone in the virtual world who is socially distancing and really helping us to flatten the curve here in the Commonwealth. These are timely issues for which have been visceral for many of the listeners and viewers, for you, I know, for me. And I'm happy to be a part of the conversation. I'm really proud to be in this brand new position, and we have to keep the dialogue going. These issues aren't new, and they'll be here long after COVID-19 leaves us. So it's really incumbent upon us to keep the dialogue going and think about how are we going to interrupt these systems that are inequitable, always have been, and were built that way on purpose.
That is the perfect context. So for many of you who don't know, earlier this month in April, the CDC released its first kind of snapshot of COVID cases and hospitalizations by race. And that sent off alarm bells for people who have not been engaged in this work, because for those of us who have, the statistics were not new, and especially for the Black community. But basically, it said that Black people are dying more than any other race. In some cases, in most states nationally, it's about 2.5 times more. Virginia is along that pattern. In some states, it's even alarmingly 5, 6, 7 times more. And one thing I'm actually grateful for is here in Virginia, Governor Northam, in response to that report when it came out during his weekly update, he pointed to the racial inequities that Janice just mentioned. So we in Virginia, not only do we have a doctor who's our governor, we also have a governor who is very aware of the racial inequities that undergird these health inequalities. And so one of the things that I sort of want to kick off the conversation with, even though there's a lot of attention that's been happening since that report, my concern is that people will, once the pandemic kind of hits bends and the rate drops and we're able to leave our homes and we're no longer sheltering in place, that this will no longer be such a priority or the focus that it is. A lot of people just in sort of the emotional and spiritual kind of coping is sharing this too shall pass. And so my concern is, well, I don't want the issues to pass. Like, we need to keep this in the forefront. What sort of advice or plans do you both have in mind in your work to really maintain the momentum and the focus on this issue in terms of health equity and dismantling those structures? Janice, will you kick it off?
Sure. And that's a great question. I think that to answer it fully and transparently, you've got to think about, how do you institutionalize this work? Racism is institutionalized. So how do you make mechanisms part of the conversation, so the mechanisms that fight against the institutionalized racism don't go away? Because as you mentioned, people are only concerned about it when you're in a crisis. This kind of work is only exciting or talked about when we're in a crisis. When the crisis goes away, how do we keep the conversation going? And one way I will just share with you is in a position such as mine. Virginia is the only state that has a cabinet level chief diversity officer. And why is that? How do we interrupt these systems nationally? How do we keep the conversation going? You literally must make sure you build in mechanisms that will stay around, right? And so I am encouraging every governor of every state, left on right, middle, liberal and conservative, if you're interested and you already have a task force in a very reactive way, right? How do you do this after the fact? Because a lot of states started their task forces after the fact, after that CDC report came out. And they're saying, and they're mentioning, hey, this is important. We want to do something about this. And that's great. But then what happens when the pandemic is over? Are the task forces going to continue their work? Well, in Virginia, we will. Our task force, our equity leadership task force, which governs the health equity working group, was placed at the top of the unified command. That is incredible, that is historic, and that is unprecedented, because Governor Northam, and might I add, Commissioner Dr. Norm Oliver, they said we must prioritize equity at every level, vertically and horizontally, in this response. But what's interesting is that it is my intention, because my position has been codified by the General Assembly, that there should be an equity lens and an equity working group every single disaster that Virginia ever sees from now on until the cows come home. So this is something that we intend to do and fight against, even once this pandemic ends, and continue the work, because simultaneously we're responding in this real time, but we're also thinking about how do we simultaneously deal with the systems that are inequitable, that are the reason why we see a disparate impact on the Black community.
Thank you. And Eli, would you like to, from your perspective at the Baptist General Convention?
The Baptist General Convention has been actively engaging our membership in paying attention to health for almost 40 years. Our aim is that every one of our more than 1,000 churches would have one or two point persons in each congregation whose role is to receive the health information that we disperse, to work with the connections we provide, to make sure that we can begin to make some headway on reducing the health disparities, on reducing the blood pressure issues, the diabetes, by providing information and helping people to get excited enough, informed enough to become proactive in their own health. We also know that to do that, we also have to deal with the justice issues around health. So at the same time, we've been doing the health ministry, providing information, teaching and training at all of our health events throughout the year. We also know that we have to be advocates on the behalf of the people. Therefore, our social justice ministry was merged with health, where you cannot do health without dealing with social justice. So in terms of health equity, I've been pleased to work with VDH for a number of years. I'm on one of Dr. Oliver's advisory councils so that the perspective of the persons who are still impacted greatly in the negative by some of the societal factors that have not changed. So this historic pattern of making plans without considering health. So the belief is that health equity must be a part of everything we do. In your planning your cities and planning your towns and planning your neighborhoods, and so that when you come up with policies, they consider that before there is a crisis like this. The people are already hungry. People are already struggling. People are already making the decision to eat off the dollar menu because they don't know what else to do. People are eating the cheap stuff in the neighborhood stores because there's no supermarket nearby. And the cheap stuff is the stuff that's high in sugar and high in salt, the 2 for $1 and the dollar items that people try to live off. So we still work on that, and we are pleased to work with Dr. Oliver and these other task forces that would help people to understand that just making the statement does not get it into before the people who need the information the most. And that's our uniqueness. We're able to take it out to our churches, rural, urban, suburban, in the mountains, on the eastern shore, and everywhere. So we will continue to do this. And we're very happy that our governor does understand it. He has set up some task forces that we thought we'd never see, looking at some issues and asking the right questions. I'm on several of those task forces, and I'm so happy that the agencies involved, the people representing the agencies, are actually asking the questions so that I get a chance to say, I hear what you're saying, but here's what it would take for the people I serve. And so I'm hopeful that the momentum we're gathering now would continue. And I'm also prayerful and praying that those people that we serve who don't quite understand how serious this is beyond this moment will soon, because I, like others, am grieving the loss of many people I know and have known for a long time. And we all bear the weight of that. But I do want to encourage everybody to do all they can, to follow all the precautions. Every life is precious. We can only fix things if we live through this and are able to work towards a better day.
Thank you, Eli. And so in both of your responses, you talked about sort of the merging of social justice issues and sort of that framework. And I want to stay there for a minute before we go into actual COVID response, because I think a lot of people may not quite understand what, when we say health equity, what that truly means. And so one of the examples I kind of want to posit out there, prior to COVID, one of our health equity priorities at Virginia Interfaith was the maternal mortality rate. And the fact that Black women were dying more giving birth, up to either in labor or up to 1 year after giving birth. And so this was a national trend. And so different states were beginning to work on it. And California did this massive overhaul of their system, a lot of clinical and technical and training and educational sort of interventions. And even though they were able to improve the mortality rate of all women, the disparity between Black women and other races still held. Black women still continue to die at higher rates than any other women of any other race. And so this really positions, like, wait a minute, there's something else going on here. This isn't about the healthcare system. This is about the healthcare system being a part of a larger infrastructure that's really racist. And so we're talking about structural racism, which in Virginia we kind of really don't embrace as a reality. So I want you both to kind of touch on that. Can you touch on, in Virginia, in your work, defining health equity so that people understand, maybe use an example of a priority issue prior to COVID that really can really help people understand what it is that we're talking about? Eli, do you want to go?
Yes. Yeah, the idea is that everybody should have access to all the things they need to build a healthy life for themselves. For example, when you talk about infant mortality, many people don't realize that some of that comes from people being unhealthy at the point that they conceive. So the concern has to be that we help people to learn how to live healthier lives, what to eat, when to eat it, and provide access to that food. In order to have access to the healthy food, people need incomes that they can live on so that they can afford to buy the foods that are healthy before you start talking about bringing children into those situations. And one of the things Convention has done, we've worked with several initiatives around early childhood and working with mothers before birth. Currently, we work with Urban Baby Beginnings. It's in Richmond. It's also part of the Capital Area Diaper Bank. Urban Baby Beginnings works with young mothers and before birth and after to help them understand the actual what is involved in being nourishing yourself properly, taking care of the baby properly. These things that people take for granted in contiguous communities, and I say that because many of our communities are fragmented. We don't have everything in any given community that a person might need. So connecting person to resources within and without the community to bring about some equity is what is required. So for people to understand equity, it says that everybody ought to have access to all the things they need to be healthy. Understanding that there are some structural barriers. There are some things built in, as you mentioned, Dora, that people may not be able to change immediately, but those are the things we work for. They cannot change the emissions issues. They cannot deal with with the way money is distributed in a community. They cannot deal with the inequities in our educational system where the locations where they live may be underfunded. But we have to understand that while they are struggling, we try to provide the immediate help so that people can make it through. But on the other hand, our policy making has to consider what it would take to even the playing field for others that are not there yet.
And Janice, do you want to add something in terms of what your priorities were? I know that you had started and launched a Virginia One campaign. I don't know if you want to go into that. It was beautiful, and then COVID kind of cut it short.
Yeah, and I just like to underscore what Eli was talking about with regard to health equity. Health equity is giving people what they need. And it really prioritizes that as opposed to equality. And we've all been socialized to think about equality because we want to be fair. But this country was not built on fair principles. We weren't all created free, right? And so inequity had a head start, 400 years, starting right on the shores of Virginia. And so we've got to keep that in mind, that there are invisible barriers that some people literally don't see and some people butt their head up against every day. And you can't talk about health equity without talking about the social determinants of health. And those things are important because that's where you actually hit your head, because these are things like housing availability, quality of housing and income, and like you said, food quality and food access and education. Public education is one of the number one factors. It's almost currency now and will be more so than ever, because as we think about opening up our colleges and universities after this, who will be allowed to go? Who will be afforded the opportunity to go and who won't? How will the economic divide be even larger and widened to those who never, determined that they would be in the category or demographic of vulnerable? So social determinants of health are those invisible places to some who have so much privilege that they don't even know exist. But social determinants of health is just another fancy way I've learned to say institutional and structural racism, right? Those systems that were brought on purpose. And I just also want to say, I know our time is short, that before pre-COVID or pre-pandemic, Governor Northam's priority was maternal health and infant immortality, because I have a personal story, and as an African American woman who almost died after having my first child, that's visceral for me. That I was fighting for that kind of funding because I know that as a middle class woman, that has a husband and a support system and family in terms of aunts and uncles and a church family that loved me and was holding me up, I was still being turned away and ignored, and my pain was being underestimated by my healthcare physicians. And I had access to things that some people may not have, and it still happened to me. So this has nothing to sometimes do with social economic status. These are structural things that are happening because of institutionalized racism, and it's deplorable and it's awful. And I saw a question come across the screen about what can individuals do? What can you do on an individual basis to promote or disrupt these systems of inequity and promote equity? And I think the number one thing you can do is vote. You can vote for your elected leaders that want to prioritize these things. I believe that there are some who say they want to be allies, but they really don't want to be allies. They just want to get elected. But look at those who say and put their money where their mouth is and say, I'm here to do the work. I'm here to make tough decisions. And I believe that's what Governor Northam and the administration has done.
First of all, thank you for sharing your personal, they call it your birth story. That is really very moving. And honestly, I'm going to follow up on that with you as we move this forward. I want you to continue as we switch to specifically the COVID response in terms of what you just mentioned and the priority of having the health equity leadership task force at the helm of the Unified Command. I was very impressed when I saw that online. Can you talk about what the priorities have been? I know public discourse has centered around the lack of fully getting racial and ethnicity data collected, as well as targeting testing within communities of color and those that are identified as vulnerable communities. So what progress has the administration made through the work of the task force and the working group? Can you share some of that?
Sure, I'm happy to. The task force was formed on March 11th at the very onset of the crisis in Virginia. I can't do this work without a great team. The leadership team is about 5 of us total. The chair of it is Sable K. Nelson from the Virginia Department of Health. It is also led by Curtis Brown and Dr. Lauren Powell from the Virginia Department of Emergency Management, and then Miss Alacia Black Hackett on my team in the governor's office. And that group leads a larger health equity working group. And that's an interagency task force or working group, as you said, at the top of that leadership organizational chart. And it really is thinking about how do you bring together state agencies, private human service agencies, community leaders, advocacy groups. How can you come together as one body? And we come together every Tuesday at 10 o'clock and really think about the response. The priorities of the response have been, how do we put in a crisis standards of care document and put that together using best practices so that if we ever got to a crisis, that we would already have that on hand, have that vetted by the public. Then also, how do we prioritize community engagement? Because it's a lot of times it is policymakers and elected leaders making decisions without hearing from the people on the ground. And to date, the Health Equity Working Group has convened over 10,000 people in stakeholder calls. These are calls where the governor has been on and hearing from the people. And I don't know any other governor that has taken the time to literally touch in virtual world, virtual land, all the people that he's been able to touch. And I mean faith leaders, advocacy groups, our advisory boards, the African American Advisory Board, the Women Advisory Board, and the Latinx Advisory Board, the Asian Advisory Board. All of these stakeholders are part of the Health Equity Working Group. Now, I do want to mention that in addition to community engagement, we're also thinking about training, because everyone who says they know about health equity don't necessarily know how to do it, right? They know it in practice, they know it in theory, but they don't know it in practical application. So providing just-in-time training for the Unified Command, providing just-in-time training for the cabinet, as well as just anybody in the agencies that are part of the approach, that's available for anyone to take, as well as providing consultations for communications. So the health equity leadership team is there to work with anyone dealing with communications. How do we make sure all of our products are accessible and functional to those with and without various disabilities or different abilities? Are things being translated in different languages? We've really been pushing every arm of this response to make sure that it's accessible and culturally appropriate for everyone in Virginia, so that every part of Virginia, geographical or otherwise, racial, ethnic or otherwise, gender or otherwise, ability or otherwise, has access to the most accurate and actionable information from the governor as possible, so that they can make good, healthy decisions for them and their family. So communication has been a great priority. And last, I'll just say is that the Health Equity Task Force is working with several policy mapping tools. And we are identifying those communities that need the help the most. So who are the communities? Where are the communities? What public or local governments can we work with and say, hey, let's partner with you. Local government, you'll do this, and state will do this, and we combine, build momentum, and we're trying to go into those neighborhoods and those communities that need us most. That's what equity is about. Not going and giving everyone the same amount of everything, but who doesn't have the ability or the privilege to social distance in their home? If that's you, then I want to make sure I come by and I make sure you have a mask and hand sanitizer and information on where to go to get housing or food support. That's who we need to talk to. And those are whose doors we want to knock on.
Yes, excellent. I have one quick follow-up before I turn to you, Eli. I know that there was an update that the CDC was supposed to be sending teams to different states to help them reach those vulnerable populations. Have we received our CDC team yet, or is that still on a future scheduled date?
Yes, what a great question. We met our CDC team, I believe it was yesterday. They did come to the Eastern Shore to make sure that we helped the families and workers in the Tyson's plant on the Eastern Shore. And so we welcomed our CDC team there. And where we need help, we want to say, hey, CDC, come link arms with us and continue to serve the Commonwealth and the residents that call the Commonwealth home. And so I don't know where they're going next, but right now we're really prioritizing our meat packaging plants, because we want to make sure that those workers in those meat packaging plants are cared for, that we are not prioritizing profits over lives and livelihoods. And so those workers in those Tyson plants are people of color. They're low-wage workers. And I want to champion for them. I want to stand up and say, we want to make sure you're safe and you're well, and that you can go home to your family, and because your family needs you there, and we in Virginia need you.
Thank you, Janice. I'm so inspired by all of that. I just absolutely love it. And so, Eli, one of the things that she touched on was how engaging the administration has been with the community. And so I wanted to touch on you in terms of the priorities for COVID response and moving forward for the faith community. I know you have a whole network of healthcare champions in your member congregations. Sort of how do you envision the role of faith communities in this work?
Work with the partnerships that we have already. We'll continue to work with VDHP3 and other initiatives that have helped us to inform our people. But excuse me. But at the end of the day, we cannot be totally surprised at the high death rate among African Americans, because among our partners and ourselves, we already knew that many of our in our population were very vulnerable because of health conditions that are never quite in control, whether it be diabetes, high blood pressure, high cholesterol. So when you have this, the first people to really lose their life would be those that are already not in good health. So our partnerships become even more important. We, like I said, when we can work with people who allow us to help them know what it takes to get into the door or into that house of worship. And so the thing that's often missing is this assumption by people who mean well and want to help that when you go to the faith community that everybody speaks with one voice. That is not the case. We need some internal work also. But we also need people to hear what we're saying, that when you look at resourcing, it takes as much for me to reach my people in my 1,000 churches as it does for you to reach out to your constituency. So I'm just saying there's inequity in how things are funded. There's an inequity in who's brought to the table in planning for future initiatives. So all of that we're hoping to see continue in a way that everybody becomes healthier.
Thank you all. So before I wrap up, I just wanted to ask if you all, this has been amazing. I want to echo, we've gotten a lot of comments in coming live, just thanking you all for your work, for all of your vision, and people who want to help. So I don't know if you all can throw up my email address. Definitely, if you want to continue and engage beyond this show, please send me an email, and we definitely can get you all connected. So I want to ask you all just for any last closing thought before we end the show. Janice, would you go first? And then Eli, I'll have you with your comment.
Well, thank you so much, Dora, for having me. It's so nice to finally meet you. And for Eli, it's good to see you again. I want to just encourage everyone to go and check out our website. If you want to learn more about the Health Equity Work Group, you can go to governor.virginia.gov/diversity. And it's right there on your screen. And then really learn about the position that I'm in and learn about the work that we hope to do even beyond COVID-19, because that's the key. That's how you interrupt systems. And we want to link arms and build solidarity with everyone. And the One Virginia plan, Dora, that you mentioned there, there's information there that will continue, and we will hopefully hold some virtual town halls coming very soon. And we want to keep that momentum going as well.
Thank you. Eli?
Thank you, Dora, for this opportunity. And Dr. Underwood, thank you for the wonderful work you're doing. And I also want to invite you to visit the Baptist General Convention website, bgcva.org. There you will see our list of resources targeted specifically for churches and for other faith communities. You will also see some of the scope of our work that tries to keep people in the loop in terms of health and also social justice. And of course, I want to thank our partner, Virginia Interfaith Center for Public Policy, for allowing us to be a part of the great work that they are doing. But do visit our website and do feel free to ask us questions. And if you need to know some detail about any of the many, many health initiatives that we're a part of, we'd be glad to talk to you.
Definitely look forward to continuing this work with you. Thank you for everyone who joined us online. And if we didn't get to your question, I will try to follow up with you digitally. I want you all to just continue to be informed, be inspired, and be connected to us in this work. So thank you all and have a blessed day.